This is Parker Rowen King. We had the pleasure of staying and being birthed at my job at UMMC. Early on in the pregnancy, I knew that it was gonna be high risk, and we had a few complications along the way. So he was born quite early. He was born March 19th. Which was about 8 weeks early. We spent time in the NICU for 19 days. When we first found out that I was pregnant, I went into this diagnosis called diabetic ketoacidosis. So I had to stay in the intensive care unit at UMC for about 5 days early on. And at that point, I knew immediately that the pregnancy would have some wear and tear on my blood glucoses. So at that point, that's when we joined Dr. Morris's high-risk team with maternal fetal health at UMC. So the first couple of weeks was a pretty difficult time for me and my husband. Overall, the entire pregnancy, I had been admitted 15 times, but early on in my first trimester, I was admitted at least 6 of those times. In the ICU, I had a lot of emesis along the high glucoses and everything. So after developing that issue, Dr. Morris became hands first on my team. And that's when later on in the pregnancy, I developed something called hyperemesis gravidum. Some emesis or vomiting is expected, but I never stopped. I vomited my entire pregnancy. That is where that term hyperemesis gravidum comes from. Hey, being a nurse is one thing, but being on the patient side of things is like totally different. Dr. Morris being a part of my team helped me not only with just the importance of making sure he was okay, but making sure I was okay, because I needed a ton of medication just to get through day-to-day work, day-to-day eating, just to be well at home. It was very, very important that I communicated with her every day. Finding out that I was pregnant at 29, having hyperemesis, diabetes, and preeclampsia, I joined the UMC's maternal fetal medicine, endocrinology, and internal medicine team, and they did awesome. Everybody treated me, my family, and my husband with great care.